So I would like to welcome you all in the next discussion. In the previous one, we talked about the EU regulatory and the EU landscape, but at this panel, we will be talking about what is happening at a global level when it comes to health, research, and AI. So we will be looking into AI-driven technologies, how they are revolutionizing healthcare systems at a global scale, how they can address complex health challenges in diverse populations. We will also be examining case studies, best practices, ethical considerations, future trends. And it's a great honor to, by the way, I'm Cristina Deligiani. I'm the Director of Programs and Policy at the Institute for Sustainable Development at the European Public Law Organization. We are co-organizers of the summer school for the second time. For those of you who were with us in the first edition, we hosted the summer school at our premises in Athens. So it's a great pleasure to have with us three speakers, esteemed speakers whom you might have seen in previous panels. So Mr. Zisis Kozlakidis, at the very end, towards my right, is the head of lab support, biobanking and services at the International Agency for Cancer Research at WHO. Mr. Walter Fonseca at on my right-hand side is the regional office. He's at the regional office for Europe and responsible for health systems at WHO in Athens, and he's Portuguese. And Mrs. Danai Spenzu, whom you've known probably from the previous panel. She's an accredited parliamentary assistant at the European Parliament and a human rights lawyer. So thank you all for being with us. And with no further ado, I will be asking Zisi, where we are at the very end of a 3-day program, so by now we're all on first name terms. So Zisi, I have a great question to ask you, and this kind of stems of the work that I have done for the Royal Academy of Engineering at the University of Cambridge, where I was teaching sustainability for startups that come from lower middle income countries, and I had to go through extensive training for bias to understand the context where these startups in the medtech landscape came from and what the issues they were trying to address were. So my question is, how can AI be applied in situations, in settings where we have lower middle income countries? Do we need a different approach? Do we need different designs? Or can we just have simple adaptations that are sufficient? For those of you who do not know some lower middle income countries, those are countries in Latin America, Africa, Asia, some parts of Europe as well, especially in the Balkans. So, Zisi?
Yes, thank you. Thank you for the question, and actually thank you for the discussions over the 3 days. It's been really nice to have. Actually, it's nice to have an opportunity to reflect a bit on some of the work that's been going on. Now, for the question for low middle income countries, we need to divide it into two. Low income countries are well behind of any expectation for a digital advancement. And the main reason is that we're still talking about paper-based healthcare provision. So we can have a digital advancement that is person-based by wearables, so things relating to the mobile phone. So, for example, let's say Vietnam, the mobile penetration is 170% of the population. You know, most people have more than one mobile phone, so that's easy to use some mobile-enabled technology there, but it's not going to come through public healthcare, not for the foreseeable short-term future. And to be exact, Vietnam is low on the verge of the middle country, so it's not really low income. For middle countries that we have, say, for example, in Asia, we can mention Malaysia or Indonesia, we've seen an explosion of AI-based applications. Most of them are state-sponsored, and they try to address gaps that exist in the universal healthcare coverage through a different means. So, for example, when you have your routine vaccination in Indonesia, that happens through an appointment over the phone, and then you get your baby anthropometric details, so how heavy, tall, and you get a personalized recommendation for the mother to use in terms of the diet and what they should do next, when is the next appointment, etc. But this is because there is a need, there is a gap, and the government sees that as the easiest way to address the gap, leapfrogging all the stages that we had to go through in Europe. So I don't think a simple adaptation, coming back to your question, will be sufficient in most settings. We would have often to think outside of the box to see how this can be addressed. Another example from Central East Africa, so Kenya, for example, you have the microtransactions on the mobile phone. So a lot of the success of the vaccine delivery for COVID was because it was using the same system that these microtransactions use. So you had a familiar system that is very different to what we have in Europe, but the application was based onto that system so that the familiarity for the local population is there and they can adopt it. I think we have many examples where a technology has just been thrown over the fence to a particular country and hasn't worked. And I think expecting a simple adaptation is not sufficient. And that's a cost. That's a cost that has to be anticipated.
So you mentioned the microtransactions app. I know of certain applications stemming from the private sector, especially in India. And I know that WHO has been doing a wonderful job in many of those countries when it comes to nutrition, when it comes to vaccination. I'll just give you an example of, lessons to women in India, mothers in India, to prepare less spicy food so that babies and toddlers can be well fed, because there's a culture of, too spicy food for toddlers. So do you have any other examples of successful AI adaptation at a national scale by governments in these countries?
Yes, and for the audience, I'm being asked first because I have to leave for the airport.
Yes, apologies.
It's not favoritism.
No, it's not. And this is why you're seated there, so you can, largely go away.
Yes, there are some good examples. So we have most of these examples would come from Eastern Africa, so Ethiopia or Kenya, to a lesser extent Botswana, Rwanda, and then mostly in Southeast Asia, and that is because they're so accustomed to the technology, and it's an easy task to introduce something new that is compatible with the technology that's already there. So for example, a simple innovation that has taken Malaysia and Indonesia by storm is the booking of your hospital appointments. It wasn't a new application. They used the booking.com backbone, and they just adapted to the local situation. So they have a person in the hospital that says how many appointments are ready, and then that allows people to book well in advance, to know that this is an expenditure that they have to make to get there and get back. But it's for certain that they're going to see somebody. So that has improved the healthcare provision. It's a very simple adaptation, very clever. They used what's already there, but it works.
Great. So, in order not to be, called prejudiced, Walter, the next question is for you, and it draws and builds upon the previous discussion on EU legislation. So, my question regards policy making regarding healthcare. So, how can we use AI-based tools to actually support the adoption of a data-driven policy-making environment in healthcare?
Thank you for the question. It's quite interesting because usually we look for AI tools and machine learning as we are speaking so far to the point of care, so how we use them to provide better care to patients. But actually, if we look for the three main crises we are going through in the health sector, we can summarize them in three main topics. One is so-called crisis of value, which deals with sustainability, financial issues, and so on. The second one is called the crisis of evidence, and the third one is the crisis of purpose. The crisis of purpose is much connected with human resources and shortages and people abandon services and so on. But the middle one is the crisis of evidence. And this one deals with the fact that we are overwhelmed with evidence, facts, numbers, and data. So it's really challenging how we can select and how we can choose which is the data that is useful. So I think here we have a huge opportunity to use these kind of tools to help us dealing with the amount of information that is outside the human capacity nowadays, without any kind of digital or AI-based tools. So this is to be straightforward. I think AI tools can also be seen as supporters to policy making and to even promote more evidence-based decisions and not only as tools for the point of care. So I guess this is a very interesting perspective, probably is easier in terms of data protection and so on, because we are not dealing directly with care provision at the point of care level, but it will probably be a huge need because no one will accept with a huge amount of evidence that we have today that we do not provide care in an evidence-based way. So we need, and also connected with the previous panel, Sarah said she would like to see more evidence in the policy-making process, but the challenge is how we manage the amount of data we have.
There's also the additional, level of how can you foster a nexus of science-based evidence and policy-making, because in many cases, policymakers might not have a medical or healthcare background. So you have to render the evidence or the data that you have in not simple or simplistic, but in terms that are more easily interpreted and analyzed by policymakers who could be generalists. And following on the previous discussion, by now we are all EU digital health legislation experts, but how do you think that EU legislation can interplay with AI and global health and global healthcare initiatives?
Yes, I think this is important to bear in mind. So, on EU level, we do have some legislation now. We do have the European Health Data legislation and the AI Act, which is the first comprehensive horizontal instrument that are going to legislate artificial intelligence. And of course, we need to believe that EU will have some influence in the rest of the world. So if there are not any, there will be, of course, a lot of countries that will have to draft such legislations. And of course, the countries that want to work and collaborate with our market, they will aim to adapt in a similar way with our legislations. But as we said, it's a very different way that we produce legislation in the European Union and very different one. For example, in the US, you told us, Dimitris, that you have case litigation and the judges sitting from a bench, they are creating the laws. For us, it's very, very different. We need to believe, though, that we will foster collaboration and we'll try to have some similarities like data operability, transferable, ethical use of AI that will be kept when other legislators will try to do the same, hopefully.
And there's another perspective that we haven't really talked about, and that is the EU mission on cancer. I'm not really sure whether you know the European Union missions. There are 5 missions that address very important challenges that the European Union member states face, like climate change adaptation, restore erosion and waters, soil and health, and the challenges of cancer. So how does this mission actually interplay with what ZIS is doing at WHO or at with other initiatives at a global level?
Yes, so cancer has always been in the center of the European Union, like in the last few years, and in the European Parliament and the Commission, there were a lot of initiatives. So we had a special committee about it and a report that was produced, and it's all part of the EU Beating Cancer Plan. Part of this is also the mission project that you mentioned, which will try to focus a lot on the early diagnosis, early intervention, and more personalized care for cancer. This is important to do. We always have to have focus on cancer because unfortunately still today about 3 million people and citizens in the EU are affected by cancer, and almost half of them are unfortunately dying. Because although we can prevent a lot of cancer types or we can have early diagnosis, this so far has not been very successful. So AI tools can, of course, have a very big part in that. They can make projections and then suggest the best type and screenings that you need to do based on the demographics of some population and geolocation factors, and they can then make more accurate suggestions on at what age, what type of exams you would have to do. And it's very important to have more accurate diagnosis on that, and we have a very big part on this.
Thank you, Danai. And then I have a question for Zisi. Zisi, you're still here, right?
Yes,
Last question. So, and it's a question that I want all our panelists to actually address. So, there are so many AI tools, so many devices. How can this actually address and improve the effectiveness of the quality of care that patients receive?
So from our perspective, the motto of the agency is cancer research for cancer prevention. And in order to get to the prevention, you need really high quality data. You need the cancer registries to be there, to be doing the job. You need to have the intervention programs, for example, the HPV vaccination, human papillomavirus vaccination that prevents cervical cancer from developing later on in life in females. So we need to have the good quality data, and actually for most of the European Union we do. I think the latest report is that the digital landscape covers about 80% of the EU health space, which is sufficient data volume to provide you with enough evidence to take decisions. From that point onward, I think as the population in Europe ages and we're facing comorbidities, we're facing increasing levels of cancer, but not just cancer that you treat, but cancer recurrence time and again, that's where that data will have the most impact.
Walter, so that we can have the WHO perspective, and then we go to the European Parliament, which is more specific.
Thank you again. I guess there are two perspectives on your question. So how AI and digital tools can improve the quality of the care that's being provided to patients. And the two perspectives are, probably on the individual basis for each patient and for the population and the global perspective for the world in general. So the first perspective is, of course, much more straightforward because it connects with dealing with evidence, supporting decisions, supporting patients in increasing their skills for self-management, for instance, which is a very good approach to empower patients in the healthcare and so on. But let me try to highlight a bit more in this intervention the global perspective, in which way we can use AI tools to improve quality that is also for everyone. And I think this is one of the biggest challenges probably, because we have a very diverse world, as you know. Even in Europe, there are very diverse countries in the region. So here, I guess the challenge and the way forward is to assure that the AI tools that we are developing are actually fit for purpose, meaning we are dealing with them to improve health for all and not just for this specific category of cancer or this specific category of heart failure or this very rare disease that affects only some amount of people in the world. So if we can use AI not as a very far-fetched approach, but to go for those populations living in remote areas that otherwise don't have access to care very easily, or to improve the way we care about people from other cultural backgrounds in our own countries, because we have language barriers, cultural barriers. If AI tool can help in this equitable aim, I think it will be completely aligned with better quality for all in a global perspective.
Thank you. And then in the previous panel, the former, thank you, Zisi, thank you, Safe Travels. In the previous panel, the former member of parliament was talking about countries with a small population like Cyprus, like Malta, like places like Madeira, where you have, for instance, not a huge percentage of rare disease patients or other diseases as well. So how does the at the European level, how can we actually use AI based tools to improve the quality of care, any clinical decision supporting systems, etc.?
Yes, thank you. And also to say that I agree, and I wanted to compliment for the arguments both Cedis and Walter, and that there are different perspectives and benefits. And at EU level and at national level, if we use AI tools correctly, then we can revolutionize our healthcare systems. Because among different member states, you mentioned a few examples of very small member states that they have maybe limited resources on specific diseases and rare diseases or on expertise on specific topics, but also there are different inequalities and disparities among the different member states. So to address these, I think these technological tools, these digital tools can really help us improve some of these factors. For example, they can address shortage of supplies, of resources, human resources. They can help have more accurate and fast diagnoses in periods of crisis when you have limited people and healthcare professionals helping. They can and sometimes be used to have projections personalized for each patient to avoid in the future, this is especially important for chronic diseases, to avoid in the future having a hospitalization. So they can be then also used for policymakers to make long-term decisions based on evidence-based for what is going to be then in the benefit of the individuals as patients, the society, and then what is going to be the economic benefit if you try to invest more on diagnosis, early intervention, and personalized treatment. So this is very, very, very important. And then there is another factor, environmental factor, actually. We can even run clinical trials on computational models. We have discussed this in the last summer. There was a presentation. So there is a digital twin. You can have an avatar based on the patient, and they're going to run clinically on the computer the different clinical trials there, and then you search all the outcomes so that you only then have to use in real life the resource that is more beneficial, having a benefit for the patient, but also economic and environmental, with less waste of chemicals, pharmaceuticals, and then turning the healthcare system more sustainable.
Great to hear about the environmental part of it, and great to hear about digital twins. This is something, a concept that the European Union has been using a lot, especially in climate change and in as regards the ocean and waters. And last question for you, Walter, and then we can just open up the floor for questions. So you work on health systems at the regional office of WHO in Athens. So how does WHO as an organization look at the interplay of AI and workforce when it comes to building up high-quality, functional, effective health systems? And if you can tell us a little bit about your experience in Athens at the regional office, that would be great.
Thank you again for the question. They are all very interesting. Probably the positioning of WHO on the usage of AI tools is, generally speaking, very optimistic. As far as we can assure some of the principles that follow a human right approach to health, which is the grounding principle of WHO. So meaning that AI tools needs to be fair, needs to be connected with concrete needs, needs to be connected with improving outcomes that matters to people. And there is a very, besides all, of course, the equity topic that I addressed before, and I guess the message that also came actually from a digital symposium that WHO hosted last year in Porto, Portugal. There is this message that is very clear. Let's use technology because we need it, not because we have it. And I think this can summarize a bit the perspective. So it's not about let's use just for the sake of usage because we can develop it. Let's use because we need it. So ensuring it's fit for purpose. When it comes to the work done by WHO, there are very things that WHO is doing around technologies. But actually today it is much easier to propose interventions to improve quality of care through the usage of technologies in general and digital tools in particularly. And to finish, I will just give you a very concrete example. So some years ago, before the technology advances that we are discussing now, fostering quality of care would mean for the workforce more work because it will be about checklists, and more protocols to read and more things to be aware of while you are doing your daily practice. Now we can play a bit and be a bit more ambitious because we can do it reducing a bit the workloads of the workforce. So it is much more acceptable and likely more easy to implement this kind of measures. So it's a partner as far as we use it because we need it. Thank you.
Okay, as a partner. And in the beginning, I was like, okay, is he referring to Isaac Asimov, the rules of AI, of robots? Thank you for that. And let's open up the floor for questions. Any questions for Danai or Walter? I'm sure I know you're tired, but okay, I see a hand at the very back. Our Irish friend.
Yeah, I'm just interested in this evidence-based policy because I have a PhD student who wants to talk about this. And I mean, do you think this should be in hard law, an obligation to take in evidence? If so, what evidence? Because as we were talking about, the amount of evidence is crazy. Should it only be peer-reviewed journals? Should it be? How far should it go? And how far do you leave the room open for ideology? Because, I mean, people who make policy, they're also there to represent ideology, not just evidence and fact. So I'm very skeptical about how this could ever be implemented, and even if we should desire that elected people have to take into account evidence, because I can't see how it could ever practically work.
Walter or Danai, whoever wants to go first.
You want to go first?
Ladies
Maybe
first.
just a short comment. I would rather make it more strict to those that are relevant scientific facts, not so much the opinion articles, but evidence-based projects and data, I would say.
Thank you for the question. It's quite interesting because usually you use the word evidence as a buzzword and it includes many things there. So actually on the first day of this symposium, I was talking about decision-making processes. And I mentioned that even if we go for the very strict evidence-based medicine concept, evidence coming from peer-reviewed journals is just 1/4 of a decision, because the other 3 parts is values and preferences, availability of resources, and a balance between benefits and risks. So probably the better term that we would like to highlight when we are talking about this topic is, let's assure that policymaking is evidence-informed. Of course, it's not enough, because there are many other variables in the society regarding feasibility, cultural acceptance, and so on, and also communication tips. What we need to do, for sure, in my opinion, is to avoid policy-making decisions that are against the evidence. They can have some twists. Sometimes it's a matter of timing, sometimes it's a matter of context, but being against the evidence, or at least having a policy in a process in which you ignore the evidence because you didn't know about it, I think it's a bit risky. So I would suggest that we go for policies that are evidence-informed. Of course, coming back to my first comment, when we talk about evidence, this doesn't mean only peer-review randomized clinical trials, because there are none for many things that you need to do policy making. So let's at least have some evidence, some data that is controlled for biases, not only opinions. And I'm not a lawyer, but I would say this could be a good practice for policy making, but I have no idea how you can demand this in a law. But that is a topic that I don't have knowledge to discuss. But 2 main messages. So evidence-informed policy making, better probably than evidence-based, considering that evidence is a wide range of data, not only the most classical studies that are randomized controlled trials or studies like that. I don't know if this addresses a bit your question. Thank you.
Any other question? Thank you, Walter. Yes, Vivi.
Yes, I was thinking that perhaps we should stress a little bit more the effect of climate change on health, human health, and the fact that because of climate change, there are already, in fact, many AI tools available to help all these people that work on climate, early warning systems, for example. But we know for a fact that even though there are many already out there, the ecological footprint is very high for all those AI systems that have been developed so far. So we need to carefully examine that ecological footprint and then go further and examine one by one all these communicable diseases and uncommunicable diseases and how eventually our health is going to be affected. Antimicrobial resistance as well, it should be considered. And I think it would be a nice topic to consider maybe in an upcoming third summer school to have a whole panel discussing these issues. It would be, I believe, a very good addition.
This is a great idea and something that we will be for sure looking into in the next edition of the summer school. So sustainability, sustainable development, and climate change. I will just let you know how this, like climate change, affects us all, but there's not enough evidence how it relates to health evidence. I mean, there's not enough data, but for sure, a study that was done at the very center of Athens showed that climate change affects mostly, especially in terms of health, mental and otherwise, vulnerable populations. And vulnerable populations are the elderly and women and children. So imagine high temperatures during the summer, especially the elderly, because for economic issues, but also an aging population means that there are not enough people to take care of the elderly. There's also the social part of it. The elderly did not really go out, did not, ask for help. So there's this vulnerability that comes from climate change, especially in the urban centers, that affects mental health, affects our, well-being, our health in general. That we have to look into in more detail, but we also have to look into how to build resilience in urban centers, especially when it comes to climate change, and how we can make mechanisms and how we can have best practices towards climate change adaptation for vulnerable populations. And there are other issues, other perspectives, migrants in rural areas of Greece or on islands. So many things that we have not really looked into, but there's so much that we can do. Walter, would you like to add something to the climate change or the sustainability in general perspective?
I think it's a great topic. It's a topic of today, naturally. I think it's very interesting to look for all these innovations also from a sustainability perspective and climate impact, because probably something that we don't know as such, generally speaking, not for the experts, usually they know. I think it's a very good topic, and also I think we could try to be a bit more ambitious when we talk about climate change and also other cross-cutting areas that we are not so used to see when we talk about AI tools, such as healthy aging and mental health issues, because this is our society challenge, especially in Europe. And we are focused, of course, in non-communicable diseases that we need to address, for sure, cardiovascular diseases, respiratory diseases, and cancer. But what about mental health issues that are not only affecting the more aged population, but also children's and adolescents, which will be the next generation in our society. So how they will deal, because they will have a different divide in terms of digital knowledge and literacy. So also trying to, this is kind of concluding the symposium, this is not my role, but I think these topics could also be brought to the discussion of AI and regulations, health sector and so on, for sure.
There's also something which has which is emerging when it comes to innovation, AI, and investments, not only in med tech, but also in green tech or blue tech. And this is, as Vivi said, so how does innovation, how does a med tech startup address not only one SDG, but many SDGs? So SDG 3, which is health, and well-being in general, okay, this is something that has to be addressed at a global scale, but how does an innovation also address climate change? How does it address sustainable livelihoods? How does it address access to it for all? So there are a lot of things a lot of layers of sustainability and of the Sustainable Development Goals to take into consideration when we talk about innovation and when we talk about medtech in general. And for sure, this is again something that we will be looking into in the next edition. And this is what investors are looking into when they're investing, when they're looking to invest in a startup that is deep tech, that is med tech. The impact, not only the environmental, ecological impact, but also the social impact, or what about the economic impact, because the economic impact is very much related to providing a sustainability in livelihoods, a sustainability in the workforce, and accessibility as well. So, any other questions? Yes?
I agree, they're all interconnected, and it's very important to address climate change when it comes to health, because there are different consequences. Is it air pollution? Is it water pollution, water scarcity? And the direct effects it might have on some populations, on their health or their displacement or anxiety and stress. Even, I think there are even young people that they are not ready to start building a family because they are concerned on the effects of climate change. So all these can fall under this concept that is building now, one health, one planet. So we connect health, environment, climate change under this umbrella, and they should be addressed together, and AI can have a role into all this, of course.
And it's good to see climate change or sustainability instead of just being a vertical. It's an issue that is now in interplay with any other sector. It's not by itself, but it's an integral part of the decision-making process, and especially when we talk about climate change refugees or migrants. So I will give you an example. In Greece, there was severe flooding a year ago in Thessalia, which is a main prefecture in Greece, and the main agricultural prefecture. And that, apart from all the health risks that that emerged, also we saw another trend: climate change refugees within Greece. And time is up. So thank you, everybody. Thank you. Many thanks to our panelists. Many thanks to you who are still here despite it being I think, the panel before the last one and before a coffee break. So thank you, everyone.